So now let's open up and let's go to Notes, page 2. Notes, page 2. Go there, please. I've got 2 statements about A and 2 statements about B that are critical for you to know. Here we go. Here they are. Number 1, when turning 65, if you or your spouse are still employed and you're covered by an employer-provided plan, enrollment into Part A is not, what's that word? What's the word? Required, right? And to enroll into Part A may not be in your best interest. Now, I want you to understand who I'm talking to. If you are not working, you're covered by a retiree plan, COBRA plan, ACA plan. You or your spouse not working. You're taking A and B at 65. Is everyone clear on that? Okay. So I'm only talking about with this statement, those of you that are going to keep working past 65. You or your spouse. You're not going on Medicare now. The question is, do you have to take Medicare Part A? And the answer is no. It is not required whatsoever. And in fact, to enroll in Part A may be a bad idea for you. Now here's why I'm mentioning this. Almost every one of you have heard that you're turning 65, you need to take Part A, even if you're going to keep working, and if you don't, you're going to be penalized. You've heard that, haven't you? Yeah, the problem is it's not true. This is not true. If Medicare A is free for you, it is always free for you whenever you take it. And here's why I'm telling you. If you keep working, you or your spouse, and you enroll in Part A, if you are contributing to an HSA account, okay, and you know what that is if you're on one, you have a high deductible health plan, attached to it is a health savings account. It's like a healthcare IRA. That money's tax deductible. It goes into an account that as long as you use the money for medical expenses, it is totally tax exempt, right? It's a healthcare IRA. And so if you are still working and you're contributing to an HSA, and if you take any type of Medicare, A or B or both, you have to stop contributing to your HSA, all right? So everyone's heard you better take A when you turn 65, even if you keep working. I'm here to tell you that's not true. As a matter of fact, if you have an HSA, I wouldn't take Part A. Otherwise, you have to stop making those contributions. So you just shot yourself in the foot. And that's the bit of the piece of the puzzle that most people are not aware of. So no new contributions to HSAs once you take any form of Medicare, all right? So now here's the truth about Medicare A, if you're still working. If Medicare Part A is free, why is it free? Remember the chart, 40 Social Security quarters. A late enrollment penalty is never, ever, 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 ever assessed. If it's free, it's always free. The only people who have to pay penalties for Part A are those that actually have to buy Part A. So if I have to buy Part A and I don't take it when I should at 65 or at retirement, those are the folks that will pay a penalty. Now here's the chart. I showed you this earlier. If you have 40 quarters or more, Part A is always free for you regardless of when you take it. If you have to buy it, 30 to 39 quarters, and this less than 29, you got to pay this monthly amount. And so if I do not take A when I should at retirement or 65, and I have to buy it, that's when I pay a penalty. Here's the way it works. For every year I go without, I pay a 10% penalty, and they double the years. So let's say I go without 1 year. That's a 10% penalty, and I paid it for 2 years. And if I have to pay $252 a month, that 10% penalty is added for 2 years. Let's say I'm down in this column and I go without 2 years. 20% penalty, paid for 4 years. So 20% is added to that, $90 every month for 4 years, okay? So the A penalties are always a percentage. And here's my question to you. What is 1,000% of zero? What's 1,000% of zero? Zero. So if A is free, it's always free. So when these people say to you, you better take A, even if you're going to keep working, you don't take it, you're going to be penalized. Is that true? The answer is no, it's not true. Only if you have to buy it will you ever pay a penalty. If you're up in that column where most of you are, there will never be a penalty. And if you have an HSA account, I certainly would not take A until you decide to retire. Okay? One more thing about HSAs they're very important to know. If you happen to have one, and let's just keep it simple. Let's say you work to full retirement age, 66 and 2 months old, and you're contributing to an HSA. Here's what's going to happen when you retire and go on Medicare. They're going to backdate your A date 6 months, guarantee you. Okay, your B date, you can pick the date, 66 and 2 months at your retirement, but they will backdate the A date. And this is why you will read in government documents, they always say stop contributing to your HSA 6 months prior to retirement because they're going to backdate the A date. They don't tell you the because of it, but that's what's going on behind the scenes. They backdate the A 6 months. Now, they'll never backdate it prior to 65, but they'll always backdate it 6 months or at 65, okay? And so stop your contributions 6 months prior to your retirement on your HSAs. Okay, so that's the way that works. Now, here's your second statement, again, notes page 2 about Medicare Part B. At 65 or older, if you or your spouse still working, you're covered by an employer-provided plan, it may be in your best interest to delay taking Part B, right, until you lose that coverage. Now, I showed you earlier, there are some people that keep working and take Part B. Sometimes that makes sense. Sometimes it doesn't. And so if you delay taking Part B, and you pick it up at a later date, and let's say we show up to work and I'm 69 years old and I just lost my job, do I have to panic about Medicare? No. I have 8 months to come in. No, I'm not going to take 8 months. I can do it in a day. But we have 8 months to come in. So Medicare is saying you can feel comfortable knowing if you don't take B now or even A now, we're not going to penalize you for that. Now next, Parts A and B of original Medicare can be enhanced or improved by purchasing separate Med-Sup plans. These are also called Medigap policies, and you buy these from private health insurance companies, all right? Now, folks, in part, this is what is filling up your mailbox, okay? These companies sending you these thick packets, hoping that you'll fill it out and mail it back in and pick up their supplemental plan, all right? Now, by the way, don't blame me for filling up your mailbox, okay? I sent you just a real thin postcard, all right? Why? Because we invited you to learn first before we try to figure out you ought to enroll in a plan. Get some education. That's the importance of learning the details. And that's why we're going through this today, to make sure when you go on a plan, it's the right plan for you. The truth is, some of you are going to want a Med-Sup plan. But the question is, why would we buy one? Why do we need to even enhance original Medicare in the first place? Okay, that's the question. Let me show you the answer. So I want you to close your notes and go back to the grid. And let's go through this. Question number 1, if you go to the hospital, is it going to be free? Yes. No, it's not. It's not free. You go to the hospital, the first 60 days cost you how much money? $1,408. That is your out-of-pocket. It's a bargain for sure, but it is not free. You're going to pay $1,408, and after that, Medicare will pay the rest. Now, if I happen to be in the hospital longer than 60 days, pretty rare, but when it happens, is that third month in the hospital going to be free? No, it's not. We have a daily copay this year of how much? $352 every day. You're in the full 30 days. That's $10,500 that you have to pay. Okay? Now, if you happen to be in the hospital month 4 and month 5, again, you're really, really sick, probably not even conscious. But is it going to be free month 4 and month 5? It's not free. We have a daily copay of how much? $702. You do the math, that's $21,000 month 4 and $21,000 month 5. Okay? And if you have no other insurance beyond that, you have no other coverage. A person that gets a supplemental plan will have a whole nother year in the hospital at zero cost to them after that. Okay? All right, so let's say we go to a skilled nursing facility. We have to have inpatient rehab, all right? Medicare says the very first 20 days in that rehab facility, they will pay all the expenses as long as what happened prior to that. Come on, 72 hours, exactly right. We got to be in the hospital 72 hours or longer, and then doc can put us in the skilled nursing facility, and that's when Medicare pays everything for the first 20 days. After 20 days, if you're still in need of care for skilled nursing, is it free? It's not free, is it? It carries a what? Daily copay. How much is that this year? $176 every day for the next 80 days. That is your responsibility. So all of those things that you and I just went through on the A of Medicare, the $1,408 and the extended copays for hospital stays and skilled nursing, those are on you folks. That's your liability. Medicare pays, but those are your gaps, things they're not going to pay. Let's talk about the B of Medicare. Medicare Part B has had a historically very low B deductible. What is the B deductible this year? $198. Every now and then I'll hear someone say $144.60. $144.60 is the Part B premium you pay monthly. Remember, it comes out of your check or they bill you quarterly. So you're right, $198 is our B deductible. That's the one that resets every January. And after we've met that small deductible, is everything in Medicare free after that? No, it's not. No, hardly. Medicare pays 80 and you pay 20%. What's the problem with your 20%? Unlimited. Sky's the limit. Sky's the limit on A and B, so there's no limit to that 20%. And the biggest problem is that's where the doctors are paid. And by the way, I got lots of docs that are clients, and most of them are very high income, and I'm glad they are. They've worked hard, they're usually very smart, they defer their income for a long time, they've got their education, and I'm glad they make great money. I am, okay? But the problem is I don't want my clients to have to pay 20% of what the doctor makes, okay? That's why we get insurance. Medicare pays 80, you pay 20, and your 20% is totally unlimited. And then there is a possibility that we go to a physician that adds to the bill. What's the most a doc can add to the bill? 15%, we call that an excess charge. And when doc adds that to the bill, who pays for it? You do. Exactly right. You're responsible for excess. And all of those items there on the B side are your gaps. So we had 3 gaps on the A and we had 3 gaps on the B. And so the majority of people who decide they want to stay in the original Medicare system will look at those gaps, those financial liabilities, and say, I don't want to take on that much risk. And so they'll take that risk and they'll transfer it to an insurance company. I look forward to having you join me in the next video so that you can continue learning the ins and outs of Medicare. When you're ready for personalized advice for your situation, all you have to do is go to MedicareSchool.com in order to get in touch with us. When you get there, you'll be given the opportunity to schedule a time to talk with an Enlighten You Medicare consultant. This is a completely free service for you and there's no strings attached. We'd love to answer your questions and if it makes sense, help you choose and get enrolled in the best plans for your needs.